Greetings. So in this video, uh, we will talk about growth factors, okay? And so when we're talking about medications that are given as growth factors, okay, what are we trying to do in immunology? Well, if somebody is having a low WBC count, can I get them to grow some WBCs and get their WBCs in the normal range, which would be amazing for their immune function. And so we, uh, this is coming straight from A&P or Anatomy and Physiology. So if you're not sure, I want you to review that video. But remember when we talked about leukopoiesis or how WBCs get created, right? We have the stem cell, which can get acted by erythropoietin, gives us RBC, red blood cells, thrombopoietin, give us platelets, and then colony stimulating factors, which gives us WBCs, right? So essentially, these drugs are very similar to the colony stimulating factor, and they give us WBCs. And that's what we'll be talking about. And actually, if you know this, you know about 70-80% of the information. So you have colony stimulating factors. So there's two kinds of growth factors generally that we're using. There's colony stimulating factor and there's macrophage colony stimulating factors. So again, the name will tell you what we are trying to stimulate and which cell line are we trying to stimulate. Uh, the the colony stimulating factor, the prototype medication is Neupogen, okay, or it's filgrastim. And then you have another drug, which is pegfilgrastim, okay. Again, prototype is Neupogen, which is this medication over here. How do I remember it? Uh, this is again a cheat mnemonic that I try to use. Stimulate. That's the last four letters of these two words. What does it do? We've covered it already. Stem cells gives us WBCs. These lines of drugs in particular gives us more neutrophils. Okay? So if the patient has low neutrophil count, what's that? Pinia plus neutrophil is neutropenia. We give them this medication. Increases their neutrophils, brings that count back. Is it working? How do you know it's working? Well, the WBCs, so as a nurse, as a provider, one will order CBC or complete blood count or get their blood labs and check WBC count and the neutrophil count, and there will be a trend of those counts going up. That's how you know it's working. Now, what are some of the side effects? Well, what does it do? It stimulates production of WBCs and neutrophil. Well, what if it stimulates it too much? If it does, you've got to do something about it, right? So that's one of the side effects, too much WBCs. And the numbers can go pretty high. Again, too much, too little is not good. How, what do you do to prevent this side effect? So again, the provider will order a complete blood count, and as a nurse, you'll monitor complete blood count. And again, if the blood count is normal, neutrophil count is normal, life is good. It's done usually twice a week. If it's above a certain level, which is high, we call the provider and an intervention needs to be done. Where, so that's side effect one. Where, what does this medication stimulate? It stimulates the bone marrow, right? So obviously they may have some bone pain. Intervention, if it's bad, Tylenol or some other medication, and consultation with the provider who will order it. Okay. Um, Contraindication, sensitive to E. coli, which is a bacteria protein. Okay. So that's this drug for you. Easy. Okay. Now, the other one is again a colony stimulating factor, but it's more macrophage colony stimulating factor. Okay. It's called leucine or sargramostim. That stim tells me it's a stimulating colony stimulating factor drug. Increases the granulocytes. What are granulocytes? If you're not sure, watch my ANP videos. Okay. When do you give these drugs? When do you give these drugs? Well, somebody is having low granulocyte count. Let me give it to them. So what are some times when you have low granulocyte count? Well, when we do bone marrow transplant, what do? We zoink out or we kill somebody's bone marrow, okay? And then we put in a graft of a donor bone marrow. So when you take out the person's bone marrow, right, what happens to the WBC counts and the granulocyte counts goes down, right? When you're grafting somebody's donor bone marrow, it takes a while for the bone marrow to produce WBCs, right? So again, this drug will accelerate that production of WBC during bone marrow transplant. How do you know it's working? Well, it stimulates different white blood cells. So the white blood cells are going to go up, right? Tell me what the issues are. Bone pain. Why is that? You're absolutely correct. Stimulating the bone marrow. What do you do? Consultation with the provider, Tylenol. What else? It can increase WBCs, absolute neutrophil counts. WBCs are white blood cells, and platelets. Okay? And if any of these lines go high, you got to call the provider and notify them. And for getting these lines and tracking how high these numbers are going, our intervention is to monitor complete blood count twice a week. And again, that's what the provider will order. If they haven't, we we call and uh, request input from them. Some of the contraindications: sensitivity to yeast. Okay, that's it. That's actually these two medications. So again, what did we cover? Let's go through it again. We talked about growth factor. So again, growth factors, the way they work is stem cell colony stimulating factor give us WBCs. We have two of them, colony stimulating factor and macrophage colony stimulating factor. These are the stim drugs. So you have Neupogen, which is prototype for colony stimulating factor. If they increase neutrophil, if this medication, this type increases neutrophil, that's what it does. How does it do it? We've talked about it. How do you know it's working? Well, the neutrophil count will go up. Okay. Well, how do you know it's going up? Well, some of the intervention we are going to do is monitor complete blood count that the provider should be ordering, which should be uh, twice a week is generally what is ordered. And again, the nurse can track, asking the provider of the WBC counts that are appropriately going high. If it goes too high, again, we got to let the provider know. And then again, it stimulates bone marrow. So there may be some bone pain, and if it's too much, in consultation with the provider, we give Tylenol. Contraindication: sensitive to E. coli. Patient sensitive to E. coli. The other one is the macrophage CSF, which is sargramostim or leucine. So again, stimulates granulocytes. How do you know it's working? WBC counts are going to go up. Side effects, again, you have WBC, absolute neutrophil count, and platelet counts that might go super high. So again, we monitor complete blood count twice a week, and then we monitor for bone pain. We also make sure patient is not sensitive to yeast. If they are, we don't give this medication. Usually given during bone marrow transplant, and we talked a little bit about how the bone marrow transplant gives rise to decreased white blood cell count. So again, we give this medication to stimulate more white blood cells.